In this video, we listen to Chair of POTS UK and retired GP Dr Leslie Cavey talk with Dr Boon Lim about the importance of fluids and salt in managing POTS. We also cover some of our top tips for managing your diet.
So, Leslie, I'm going to ask you a few questions about the conservative strategies that our patients can adopt to try and improve their well-being and their health. Tell us about your top tips on fluids and why fluids are so important.
Well, people with POTS often have a low blood volume, so that means that the blood that's circulating around in their bloodstream is too small for the capacity or the size of their blood vessels, so they need to bulk up that blood by drinking increased fluids. And we usually recommend that they have 2, preferably 3 litres a day, and sometimes even more in a hot environment or if they're exercising.
So I've had lots of patients say to me, what's the point? I drink more and then I go to pee more. I can't do my work I'm teaching and I have to take multiple breaks and I don't feel better. How would you explain to the patient to counter those responses?
Well, that's where the salt comes in. So if you have increased the salt in your diet as well, it helps to sort of suck in the fluid and keep it within the blood vessels.
And how much salt should you be having?
So most people would have approximately in their diet about 6 grams of salt, and you want to at least double that during the daytime. You can either have that as extra salt on your food, or you can have it in salty foods such as crisps and nuts and olives, and there's a list on the POTS UK website of some suggestions on how to get extra salt into the diet. Some people really struggle with that, and they find it's easier to have things like sports drinks, which often have extra electrolytes in them, which are salts. But you've got to be careful with some of the sports drinks because they can have a lot of other stuff in them too that's not so good for you, such as lots of sugar. And occasionally, people who really, really struggle to get the salts into their diet will take salt tablets to supplement it as well.
Okay. And is there a way or a time of the day in which you would recommend having the salt and the fluid, which is more helpful in day-to-day patients?
Some patients tend to get rather dehydrated overnight when you're not drinking. So it's really, really important to get your fluids and your salt into you as early as you can in the morning. So what people tend to do is have a bottle of water on the bedside table, and then they can drink from that before they even get out of bed. And if you've got the time, it helps to maybe allow half an hour before you get out of bed so that that fluid is absorbed into your blood vessels. And then, like we mentioned before, if you can get some of the salt into your diet during breakfast time, then that'll help to keep the fluids in there.
I know that half an hour is a perfect time to set up yourself in the day with a meditation and a breathwork practice. So you are calming the autonomic nervous system down just as you're about to get up and activate it. So that kind of slowing of getting up routine might be helpful. So any other top tips around fluid and salt you can kick off?
I mean, it's really helpful, first of all, to look at how much you're drinking in the day, because some people are actually not drinking as much as they think they are. When you are trying to boost your fluids, and you can buy bottles that have measures in them, and some of them have little targets throughout the day as well, and these will help to remind you that you need to drink a little bit more. And if you like technology, there are some really nifty little apps around, and when you do have a drink, you just add it to the app and it gives you a big fanfare when you've actually hit your target.
Good. So patients will say, when do I know that I'm drinking too much water or having too much salt? Can you speak to some of that?
Well, first of all, our kidneys can only handle 1 litre of fluid every hour. So you need to make sure that you're not drinking more than 1 litre of fluid an hour, because that will lead to water intoxication. Another sign of that is that your urine will become completely clear in colour. When you're trying to increase your fluid intake with POTS, you're really aiming for your urine to be a sort of pale straw colour, and that usually indicates that you're having about the right amount of fluids.
Okay, and what about the patients who are very concerned that having salt is bad for you and might cause hypertension?
There are situations in which salt would be contraindicated. And in these situations, you shouldn't be having a high salt diet unless you've taken advice from your healthcare professional. Some examples of these conditions include things like hypertension, heart failure, kidney disease, and particularly in children who are smaller, they're very, very sensitive to high salt intake. And again, you really would want advice from a healthcare professional about the amounts that the child should be taking.
Yeah, so the other point that I'd like to raise is for those who are exercising or even commuting to work, having a loading before exercising and before commuting is quite helpful, particularly if you find yourself being limited halfway through the commute and needing to step off the train or the bus, because this can really help anchor down wellness, or at least maintain your blood pressure and volume for the next hour or two. So that's the other top tip that I would say. Keep yourself hydrated pre, during, and actually post exercise, like 3 times to drink when you're contemplating exercise, in which you can lose fluid and salt.
Good advice, and keep it.
Many people with POTS report allergy or intolerance type symptoms, including skin, stomach and bowel problems. If you suspect food is causing allergy or intolerant symptoms, keep a detailed food and symptom diary, also noting down any changes such as medications, illness or hormones. This will help you to identify specific foods that may be causing symptoms for you. A dietitian or registered nutritionist can help you explore this further. Starchy carbohydrate foods such as bread, pasta, rice and potatoes are staple foods that provide us with energy. However, some people with POTS find their symptoms are worse following a high carbohydrate meal. This may be because when we eat, blood is diverted to the gut for digestion, and this may lead to a small drop in blood pressure. To avoid this, try eating small meals and snacks throughout the day. Meals that are high in protein may help. Do try to avoid food low in refined carbohydrates such as white bread, white pasta and white rice. More detailed information can be found on our website, but some of our top tips for diet include aiming for 5 to 6 small meals a day, choosing high protein and high calorie foods when struggling to eat every meal, choosing full fat, full sugar products if you cannot eat your usual portions, aiming to have 1 pint of full fat milk or milk alternative a day. This can be in drinks, cereals and puddings. You may find ready-made meals or easily prepared foods are easier to eat. Try and choose good, healthy options where possible. Avoid large portions. Use a small plate at meal times. We hear different reports from people about caffeine. Some people report it benefits, and others say the opposite. We advise it in moderation and to monitor how it makes you feel.
I just want to say to the group of patients who are watching this that just always remember that these lifestyle measures all work together. Salt and fluid are just 2 of several different strategies that will all come together to help improve your overall health.
In summary, people with POTS are known to have a lower blood volume, and this, along with blood pooling, leads to many of the symptoms of POTS. To increase blood volume, more salt and fluid is advised for most adults. If you have heart or kidney disease, high blood pressure, or for children, always consult with your doctor for advice on how much salt and fluid to have. We strongly recommend taking the time to read all of the information within the Managing POTS section on the POTS UK website. Lifestyle changes can make such an enormous difference. There is a lot of information to take in, so take your time and learn what is best for you and your body. For more information, visit www.potsuk.org.